It's 2 in the morning, your calf locks up so hard you nearly fall out of bed, toes curling, leg turned to stone. This isn't a magnesium problem, it's a nighttime blood flow problem. And there are a few specific reasons your circulation drops the second you fall asleep. One of them is the one almost nobody checks for. You've probably tried magnesium already, maybe for months, and it barely touched the cramps. That's because after 60, magnesium is rarely the real problem. The first hidden reason has a name. It's called peripheral artery disease, or PAD. It happens when the arteries feeding blood down into your legs gradually narrow, usually from decades of plaque buildup. During the day while you're up and moving, narrowed arteries can still get by. But at night, when your heart rate slows and your blood pressure naturally drops, your calf muscle can be left just short of the oxygen it needs, and it responds the only way it knows how, a hard, involuntary contraction. That's your cramp. 2 quick things to check right now. Does the skin on your lower leg feel cooler than your thigh, or look unusually pale or shiny? If either sign sounded familiar, drop your age in the comments, along with how many you recognized. Where you're watching from matters too. Colder climates tend to make this one worse. Here's the part that surprised me most in the research. Geriatric health researchers put the number at about 1 in 6 adults in their 60s, and by the 70s and 80s, that climbs past 1 in 3. Worse, up to half the people who have it never show the classic warning signs, so it just gets written off as getting older. Quick gut check, is that something your doctor would catch on a routine visit? For most people, honestly, no, not unless you ask. The muscle isn't imagining the shortage. It's not being dramatic. It's genuinely running low on oxygen for a few seconds, and it fights back the only way muscle tissue knows how. Smoking and a family history of heart disease raise your odds further, but plenty of people develop this with neither, purely from age. It's also more common in anyone who's spent decades standing on hard floors at work with no real chance to move. That's cause number 1. But it isn't the one most people are dealing with, and the one that's more common hides somewhere completely different. There's a daytime version of this same self-test, and it's just as telling. If you get a tight cramping ache in your calf specifically when you walk uphill or climb stairs, and it eases within a few minutes of resting, that's called Claudication, the daytime signature of that same narrowed artery. A lot of people write this off as just being out of shape. It isn't the same thing. Tired muscles get generally heavy. Claudication is a specific, repeatable pain, then relief pattern tied to roughly the same distance every time. If that description matches you, mention it to your doctor by name. Claudication at your next visit. It's one of the most underreported symptoms in this whole topic, mostly because people assume aching legs on a walk is just normal aging. Consider someone like Vernon, 68, from Amarillo, Texas, a retired mail carrier who spent 30 years on his feet. His calf cramps had been building for 2 years, always around 1 or 2 a.m., and magnesium had done nothing. When he finally had his circulation checked with a simple ankle brachial test, comparing blood pressure at the ankle to blood pressure at the arm, it showed exactly the narrowing we just talked about. No surgery, no dramatic intervention, just walking intervals built up gradually, and a real look at his cholesterol numbers. Within a couple of months, the nightly cramps had thinned out to maybe once a week, but Vernon's test also turned up something in his lower back that changed the whole picture. Hidden reason number 2 is lumbar spinal stenosis, a narrowing of the spaces inside your lower spine that puts pressure on the nerves running down into your legs. As the spine ages, discs lose height and that canal can tighten. Lying flat changes the geometry of your spine just enough to intensify that pressure on the nerve, and the result feels exactly like a cramp, sometimes with a burning or aching edge, or a patch of numbness or tingling that a simple muscle cramp doesn't have. One pattern worth knowing, vascular specialists actually have a name for this exact clue, the shopping cart sign. If your legs also ache when you walk any real distance, and leaning forward, like pushing a shopping cart, brings quick relief, that's a strong pointer toward the spine rather than the muscle itself. Write spine in the comments if that sounds like you. And then there's the one I mentioned at the very start, the one almost nobody checks for, chronic venous insufficiency. Your veins rely on tiny one-way valves to push blood back up to your heart against gravity. When those valves weaken, blood pools lower in the leg through the day, and at night, as fluid redistributes, the pressure shift inside the muscle can trigger intense cramping. This one is genuinely common, Vascular researchers estimate more than 25 million adults in the US live with some form of it, and it shows up more in women, and more in anyone who spent years on their feet. Beyond cramping, watch for ankles that swell more by evening, a heaviness in the legs, visible veins or skin around the ankle turning slightly darker. It also tends to run in families and shows up more in anyone who spent years standing for work, teaching, nursing, retail and similar jobs. Here's a simple way to check yourself for this one tonight. At the end of the day, sit down and prop your legs up on a pillow higher than your heart for about 10 minutes. If the heaviness and swelling noticeably ease, that's a strong sign gravity has been working against you all day. Classic venous insufficiency. Compression stockings, the kind you can get at any pharmacy, work by doing mechanically what those weak valves can't do on their own. They help push the blood back upward. It sounds almost too simple, but for a lot of people, that one habit does more for their nighttime cramping than any supplement ever did. Elevating your legs for those 10 minutes also gives your body an easier job overnight, since it isn't starting from as far behind. If any of these are landing for you, that's exactly why I want you subscribed. The specific self-checks for each one, the exact test names to ask your doctor for, all of it is coming. And if you know someone who's been told for years it's just magnesium, send them this video before you forget. Now there's one more hidden culprit, and it might already be sitting in your medicine cabinet. Then there's Louise, 76, from Rockford, Illinois. 3 years of nightly calf cramps, 4 different magnesium brands tried, nothing sticking. When she finally got a proper look, she had early venous insufficiency in both legs, and it turned out 2 of her regular medications, one for blood pressure, one for bladder control, both list leg, cramping as a known side effect. Nobody had ever mentioned that to her, not once. Between compression stockings, one small medication adjustment made together with her own doctor, and the habits we're about to cover, her cramps dropped from nearly every night to maybe twice a month. She told me she'd forgotten what it felt like to sleep straight through. Louise's story points at something worth taking seriously on its own: medication. Diuretics, commonly prescribed for blood pressure, can quietly drain magnesium and potassium along with the fluid, and low levels of both are a well-documented trigger for cramping. It shows up often enough in prescribing data that pharmacists flag it routinely, even though researchers still debate exactly how common it is in practice. Statins are the other big one, used by tens of millions to manage cholesterol, and linked to cramping through their effect on coenzyme Q10, a compound your muscle cells need for energy. A 2018 review pooling 12 clinical trials found people who added a CoQ10 supplement reported meaningfully less cramping than those on a placebo. Neither of these is a reason to panic. They're reasons to ask a specific question at your next appointment, not to stop anything on your own. Beta blockers, another common blood pressure medication, have long been suspected of cutting blood flow to the limbs, a reasonable theory since they blunt some of the same signals that open blood vessels. But controlled trials in people with narrowed leg arteries haven't actually found a drop in calf blood flow or walking distance, so treat that one as unproven rather than settled. What has firmer evidence? Certain overactive bladder medications and some antidepressants list cramping as a known side effect, the same category behind Louise's cramps. Here's the one honest exception to everything we've covered. If a diuretic has been quietly draining your magnesium and potassium for years, magnesium actually can help, but only because it's correcting a deficiency that medication caused, not because magnesium was ever the root problem on its own. Don't stop any medication without talking to your doctor first. Bring your full list to your next visit and ask directly. If this sounds like you, type medication in the comments. Now, what to actually do the moment a cramp grips you? Your instinct is to tense up and curl your toes. That's exactly the wrong move. The moment it starts, pull your toes firmly up toward your knee while pressing your heel away from you. That's called dorsiflexion, and it works because you're mechanically forcing the contracted muscle fibers to lengthen using the opposing muscle group. Hold it, breathe, and in most cases, the grip starts releasing within seconds. If you can do it safely, standing up and pressing your foot flat on the floor speeds things up even more. The pressure signals your nervous system to let go of the contraction. Quick relief matters, but preventing the next one matters more, and it starts with something most people get backwards. As we age, the sensation of thirst gets quieter. so a lot of people walk around mildly dehydrated without ever feeling thirsty at all. Thicker, less hydrated blood doesn't move as freely through already narrower vessels, and that makes the nerve endings in your muscle tissue more excitable, more cramp-prone. The fix isn't chugging water before bed, which just gets you up for the bathroom instead. Spread it through the day, a glass with each meal, one mid-morning, one mid-afternoon. That rhythm alone meaningfully cuts nighttime cramping in people who are running chronically, quietly low. A simple gut check. If your urine is consistently dark through the day, that's worth paying attention to. Your sleeping position matters just as much, and it's an easy fix once you see it. If you sleep on your back with the sheets tucked tight over your feet get forced into a pointed down position for hours. Held that way all night, your calf muscle stays shortened, and a shortened muscle is a muscle primed to cramp. Loosen the sheets at the foot of the bed, or use a small footboard or pillow to keep them from pressing your feet down. It costs nothing and takes 30 seconds to set up. A lot of people also run a fan or crank the air conditioning at night, and cold air on a tense calf muscle can make cramping slightly more likely too. A lighter blanket over just that area can help. Pair that with one more habit before bed, and you're addressing the muscle directly instead of just reacting to it after the fact. 3 to 5 minutes of gentle calf stretching before bed goes a long way, standing 1 foot forward and 1 back, gently pressing the back heel toward the floor, or seated at the edge of the bed. Slowly flexing your feet back and forth, and don't overlook your shoes. Spending your days barefoot, in slippers or in completely flat shoes keeps your calf and Achilles tendon in a shortened state all day long. A small supportive heel, even about an inch, measurably lowers that baseline tension. If venous insufficiency is part of your picture, put your compression stockings on before you're upright for the day, not after. None of this is complicated. But there's a version of this that isn't about comfort at all, and it's the part I need you to actually hear. I want to be honest about why I spend so much time on this topic. Losing a full night's sleep, night after night, wears you down in ways that go beyond being tired. It affects your mood, your patience, how steady you feel on your feet the next day. And most people dealing with this weren't lacking willpower or discipline. They were just never asked the right questions. You deserve better than take some magnesium and see. You deserve to actually understand what your own body is telling you, and to walk into your next doctor's appointment already knowing exactly what to ask for. Better sleep at this stage of life isn't a luxury. It shows up in your balance, your memory, and your patience with the people you love. Here's when a leg cramp stops being an annoyance and becomes something to act on. Swelling in one leg only, not both, that can signal a blood clot which needs same-day attention. Pain that hits you at rest during the day, not just at night. A leg that feels cold, looks pale or bluish, or has skin that's gone unusually dry or hairless compared to the other leg. These point toward the same arterial narrowing we talked about earlier, and they deserve a real evaluation, not a wait-and-see approach. If any of that describes you, call your doctor or urgent care and use this exact sentence. I'm having recurring leg cramps at night, and I want to be evaluated for vascular disease. Those words get you taken seriously. Here's the study that actually changed how I think about this. A nationwide US health survey tracking thousands of adults found that people with frequent nighttime leg cramps reported significantly higher rates of high blood pressure, heart failure, and stroke history than people without cramps. That doesn't mean a cramp causes any of that. It's an association, not a cause. But it means a cramp can be your body's early flag for something worth checking now, while it's simple to check. That's the whole point of everything we've covered. Not to scare you, to help you ask better questions than what supplement should I take. So let's bring this together into something you can actually use starting tonight. Quick recap. 1. If magnesium hasn't worked, stop assuming more magnesium is the answer. Ask for an ankle brachial test, which is simple and painless. 2. Notice whether your daytime calf pain follows the walk-then-rest pattern of claudication. 3. Bring your full medication list to your next appointment and ask specifically about cramping side effects. 4. Stretch your calves gently before bed. Loosen your sheets, and if swelling is part of your picture, ask about compression stockings. 5. Spread your water intake through the day instead of loading up in the evening. 6. If you get one-sided swelling, daytime rest pain, or color changes in one leg, get checked promptly and say the words vascular evaluation. None of these steps are complicated. They're just specific, and specific is what actually works, and specific is what finally gets you a full night's sleep again. If this gave you a real answer instead of another try, more magnesium, tap that like button. It helps this reach someone else who's been lying awake at 2 a.m., wondering what's wrong with them. Subscribe if you want more of this kind of straight talk instead of guesswork. Tell me in the comments which of these hidden reasons hit closest to home for you. It genuinely shapes what I cover next. And if there's someone in your life who's been dealing with this for years, send them this video. One quick note, this is general information, not medical advice. Always talk to your own doctor about your specific situation. Whichever of these turns out to be yours, you don't have to just live with this. See you in the next one.